Welcome. You are entering CCNA studio in STEM City, USA. CCNA is committed to equity in education, social justice, and health.
Leslie Dillard, a 35-year veteran of the United States Army, and I am proud to serve. But I'm here today to talk to you a little bit about talking. It is okay to say that you're not okay. Just a little bit about my story in this scenario. I am a two-time survivor of suicide attempt, one with pills and one with trying carbon monoxide with a car in a garage. And so I just want to share with you today, God has a purpose for your life. We all are here for a purpose. And it doesn't bode well for us to take ourselves out. If you need help, get help. Get help. It is so important for us to understand that we need to love on one another. We need to take care of one another, especially our veteran community. So I just implore you today, get help. It really is okay to talk.
Hi, good morning. I'm Jim Page from CCNA, and thank you for spending some time with us this morning. We're really fortunate today to have three mental health professionals. I'll let them introduce themselves. But before we get started, let me make a comment about Dr. Dillard's video. I've seen it about 35 or 40 times, and each time it resonates with me, and I wanted to share that with everybody to get the show started. So it's okay to talk. That's what we're going to do this morning. So rather than spending time with me, let me bring my guests on screen, and they can introduce themselves. John? Gene?
Good morning, and thank you so much, Colonel. Gene Axis, I'm the President and CEO of Creating Healthier Communities. I'm deeply honored to be part of today's conversation. It is so critical, given the confluence of issues that we're facing as individuals, as families, as communities across this country. The need to be able to spotlight. I want to thank and honor Dr. Dillard for sharing her story with us, and I'm looking forward to hearing more of her story and her insights. The opportunity for us to really spotlight and highlight and amplify the fact that in many ways we're all going through something, and the ability to talk about it and to break the stigma is critically important. Mental health is equally important as your physical health, and in fact, in some cases, might even be more important, because without your mental health, everything else cannot function the way that it should be, at least not at its optimal level. So I'm looking forward to today's conversation. I'm the president of Creating Healthier Communities. We're a nationwide nonprofit organization that engages more than 5,000 nonprofits on an annual basis, as well as 60 corporations, to really address the issues and the barriers that impact people's ability to live a longer, healthier, more productive life. Mental health is a critical component of the work that we do in partnership with many of our nonprofit partners on the front lines in communities across this country to break the stigma, to ensure that people are receiving resources, and that we're really creating a community that's healthier and can actually thrive in today's society.
John, thanks for joining us. I'm going to come back to you in a minute for a little deeper look at your organization. Christian, please.
Good morning. My name is Christian Bentley. I'm a Catholic mental health and social justice advocate and a big supporter of the U.S. Conference of Catholic Bishops mental health campaign. One of the ways that I'm able to do that is by being a board or member, pardon me, of the National Catholic Partnership on Disability, our Council on Mental Health and Wellness. And so it's important that large institutions, I love what Dr. Jean is doing with working with corporations, but also in our faith communities to have these conversations. Mental health is not a automatic diagnosis of poor spiritual health. And I think it's very important for faith leaders to have that conversation. Listen, we all have holistic health. We all have emotional, physical, mental, spiritual, and financial health. And it's important that all of these areas be given a lot of attention. I manage a bipolar 1 disorder, have done so. I was diagnosed in my late 20s, which is late for that illness, and really quickly realized through going through hospitalizations and treatment and working with different clinicians, how often there's no voice from the client, the people who are actually suffering from the illness. And so the only way that's going to change is if people speak out. I thank God that He worked it out for my good. I was able to obtain healthiness and be able to manage my wellness so that I can be an advocate for others who can't speak up for themselves. And so, very excited to be a part of this conversation and to be here with all of you today.
Thank you for joining us. Dr. Leslie, you're on mute.
Good morning. It's good to be here with you all today. Y'all heard a little bit of clip of my story, two-time a survivor of suicide attempt. And a lot of that was because of the stigma of shame, afraid to talk. Having served 35 years in the military, you just don't serve in the military and put your business in the street. And especially when I went in the early 80s, it was not good for us to say who we were, what we were struggling with. If we were dealing with something that unimaginable, you just swallowed it because during that time, it would affect your career. And so not having a place to go, a person to talk to, and then even as the years went on, you still carry that. Am I going to lose my career, my security clearance, the job that I have, because I'm struggling with depression or I'm struggling with anxiety? And so I have been diagnosed with PTSD, depression, and anxiety, but I don't claim that. It's my spiritual health is strong, but it wasn't always. And so I am a strategist. I'm a strategic leader, and that's what I do. Help organizations change their culture, change their mindset, because that's what it takes for all of us to come together to solve this mental health issue.
Les, I'm going to stay with you. Are you still stuck in the airport in Dallas?
Yes, that could become a mental issue.
Let's talk about what you're doing right now to address mental health. I know you're working for the military in San Antonio. What programs do you have in place now that addresses that issue?
Oh, the cool thing about what I'm doing now, I was actually hired to help change the culture of an organization. And we're all veterans, so that's the interesting part. And so, we get old and crusty and we get stuck in our ways.
You gotta speak for yourself.
All right, I'll speak for myself. But we don't, even at our age, even though we know what programs are out there, we have great facilities, especially in San Antonio. We have BAMs here. We have a lot of opportunities to address mental health. Unfortunately, we got pride issues as veterans. We don't want to share. Some of that is because the culture that the Army put forth initially is, as I stated, don't share your business or you're going to lose what you've attained at this point in life. And so as I turned 60 a couple of weeks ago, it really dawned on me that without some of these services, I attend therapy every week, still, because life will come at you in all kinds of ways. And so being able to get people to talk in the organization, even though they're ambivalent at times, but I think we're starting to make progress to, especially with our veterans, to be able to allow them a way to unload all that they've been stuffing down throughout their career.
Good. I'm going to come back to you in a minute. I want to talk to you about being a female in the military, being a senior officer and dealing with your issues. Let me go now to Jean. In your organization, can you tell us what you're doing and what you want to do in the community around mental health?
Absolutely. Well, Creating Healthier Communities is an organization that's dedicated to addressing the barriers to health. which includes your mental health. We realize that there's tremendous inequities, particularly in terms of where you live in our country. I typically use the example of how these disparities impact how long you will live. In other words, your zip code, where you live, can potentially be a death sentence. And if you think about it, it's because of the fact that in some communities, there's a lack of resources, intentionally so. There has been disinvestment, underinvestment in some of our communities. There's a lack of options. And every day, people wake up trying to do the best that they can in the communities in which they live in. But the policies and the structures that are in place hinders that. So in our mission, part of our goal is to really work with communities to really help ensure that there's greater equity, meaning the fact that those communities that are disproportionately impacted by a lot of inequities are receiving the resources, the support, the technical assistance that will help them be in the driver's seat of their own destiny. And what I mean by that is the fact that growing up in South Florida, growing up in a community where we didn't have a lot of resources, one of the things I saw quite a bit was the fact that there was a lot of innovation taking place, even in communities with limited resources. We know how to get things done, and we know how to jump hurdles. Now, a lot of the jumping hurdles impacts our mental health, the weathering and the stressing of all of that, but we know how to get there. And I share that to say that as an organization, we do a range of activities, particularly as it relates to ensuring that we're addressing the mental health needs of communities where there has been disproportionate impacts. Whether that is through some of our corporate partners, where we're ensuring that our corporate partners are providing grant dollars at the local level, to ensure that many community-based organizations that are providing mental health services have the resources in order to expand their reach. Is critically important. We know from so many of our community partners that they're focused on getting the resources out today because the need is so great.
John, let me stop you for a minute. Who are some of your community partners?
Well, absolutely. Clearly, we are working very closely with the American Psychiatric Association Foundation as a national partner. We have Saks Avenue, which is one of our corporate partners who actually has a grant out right now. So for anyone who's actually listening and watching, please go to the Saks Foundation. They are actually awarding several different grants to address the mental health needs in stigma, particularly at the local level.
Is that nationwide, John?
And that's nationwide. And one of the things I can do, Corner, is actually provide the link directly to that. The head of Saks Fifth Avenue's foundation is on our board of directors. And this is an area of great interest for her as well as for our organization. The Steve Fund is another partner of CHC. That is a fund that is specifically focused on addressing the mental health needs of our Black and Brown youth, which is a huge issue in today's society. We see that there's tremendous, whether it's depression, anxiety, suicide attempts, impacting the younger population at an alarming rate. And then, of course, we're also addressing the issues of social isolation, which triggers and can actually impact one's mental health.
John, I'm going to go back to you in a minute, John, but can you tell me why you have not spent any time here in Alexandria trying to help us here?
Well, Colonel, I really appreciate that excellent question. In fact, our home office, our national office is actually based in Alexandria.
Right.
So one of the areas of our 24 strategy is really to work very close in our own backyard. We're doing a lot of work across many jurisdictions across the country, but we know that the need in Alexandria is great. And we bring a tremendous amount of partners and resources to the table to work very closely with local government, to work very closely with businesses, to work very closely with our community-based organizations, because no one organization and frankly, no one sector can solve these issues in isolation. Mm-hmm. And one of the things that we've been doing as an organization, if you could think about creating healthier communities, we're a connector and a convener, meaning the fact that we bring together traditional as well as untraditional partners to the table. Because if we're really going to solve the issues of mental health and meeting people where they are, we have to really think about how do we do that in a very systematic way.
Okay, I'm going to come back to you in a minute, but I want to talk to you about what you're doing with APAF and with George and Leadership Summit, that kind of stuff. Christian, tell me about St. Joseph and what you're doing.
Certainly. So St. Joseph's Catholic Church is a historic Black church in Alexandria, Virginia. We're staffed by the Josephite community, whose charism is to serve the African American people. And we have made it our business to take care of the community. So rather that's through rental and utility assistance, food assistance, clothing drives, but it's obviously taking care of people's spiritual needs as well. But also helping break down the stigma of having the conversations, as Leslie mentioned earlier. It's a very important role and responsibility of faith communities to talk about the importance of discussing mental health in a way that doesn't disparage people or belittle what they're dealing with. Having a mental health issue does not mean you have a spiritual health issue. Uh, i- the two are not the same. And so at St. Joseph's, we have quarterly community stakeholder breakfasts coordinated by Concerned Citizens Network of Alexandria, where we bring all of the community stakeholders together at our church. We have breakfast and we discuss what's going on. How can we all work together in collaboration to make sure that we're best serving the community? It's all connected. If you have housing and food insecurity, I can guarantee you're going to have some mental health issues. If you are dealing with mental health issues, I guarantee you're going to have issues at work. And so having these conversations with all of these stakeholders, we're serving people the best of our ability. I think one of the things that I have as an advocate, right, is the frustration of you'll have 10 different organizations trying to do the exact same
Right.
thing and nobody's getting served. And
Mhm.
so when you come together, you have to have a place to do that. And St. Joseph is serving as the launch pad of doing that in Alexandria. We don't want to be the only people doing it, right? We want other faith communities and other organizations to see and playing a part in this. And we have upcoming on this 27th of this month a mental health forum where we're going to have all of the resources that are available to Alexandria City residents for their mental health needs, as well as an active discussion like this of breaking down the stigma. How do you have these conversations in your families, in your homes? How do you have the conversation with your boss? Hey, I'm going through a mental health challenge. This is what it looks like for me. These are the reasonable accommodations that I need moving forward. How do you even approach that in the world where stigma is still a major barrier to people having adequate health services?
Chris, the runner show for the 27th, what's the agenda, the broad agenda?
Certainly. Well, if I'm involved in it, we're going to have gospel music and prayer. And so it's going to be an interfaith service. Started with that, right? Started with
Is that
that.
where John is going to sing? Is that where?
John, I think we're gonna have gospel music and prayer, and really the point of that is starting off with a foundation and a footing. July is, of course, Minority Mental Health Month. As a historic Black church, we want to take that there is a benefit to going back to your foundation and your roots.
Mhm.
And so it's an interfaith prayer service to kick us off, but then going into a very interactive discussion. We'll have a panel discussion of individuals, some of them who are here today, and talking about what it's like to live with a mental health issue, how to have those conversations, and then transferred to our church hall to continue that conversation with a Q&A. Listen, people want to know what is available to them. They want to help. Now is an opportunity to provide those services for folks.
Tell me about the vendors coming downstairs to the church hall. What's the plan for that?
Certainly. So, I think the number one thing that we get as being kind of like the front line in the community is people do not know what's available. Most people, if you see it down, we have the Suicide and Crisis Lifeline, the Marcus Alert 988. Most people have no idea still that that exists. Most people don't know the services. A lot of people are hesitant to get therapy or medication management because they don't have insurance or they're underinsured, not knowing that we have programs set up right here in the community to help. And so we'll have the Alexandria Health Department, Inova, which is our major hospital system here in Northern Virginia, as well as you've heard many times, the American Association of Psychiatric Foundation, who is a huge supporter of doing these community events and programs.
Good. Let me come back to you in a minute. I want to talk to you about voice and what you're doing with behavior modification and voice. Leslie, can I come to you and talk about your time in the military, the tough times? being a Black female and having to deal with your own issues and then deal with the military. Tell me about your experiences.
Well, I would tell you, I came in 1983 into the chemical corps, which was just then allowing females
And that was in
into
Alabama.
that.
In Alabama, right?
And I came in actually in Maryland. I had
In Aberdeen?
gone, not Aberdeen. I did my basic training, so I came in as an enlisted person. I came in as a private first class, and did my training at Fort Jackson, South Carolina. And at the time, I had just finished a year of college, and just realized that college was not for me at that particular point in time. I thought I wanted to be a cardiovascular surgeon, but you got to go to class to do that. So I was hanging out too much on the corner, playing pool. So I made the wise decision to join the Army. And as a private, things were fine. That's how I met Annie. She was my first NCO.
And I'm sorry, who's Annie?
Annie Mickle. She was a Spec 5 then. She runs the ARM Foundation, which is a scholarship foundation that I sit on her board. She does an auction every year and gives scholarships away for up and coming college students. So it's a great opportunity to get plugged in and get some money if you compete. But as a private, life was good because people are telling you what to do, right? There are no real decisions that I had to make as a private. And Annie told me I was not going to be good NCO material, and then told me to become an officer. And so I went back to school, did that. But as I entered back into the active force and the reserve force, I found that the Black females, and again, we're dealing with a man's world and a white man's world, particularly during that time. And so trying to forge my way, do the work, do the job and do it well, but understanding that I always had to be 2 or 3 times better than, the next person. That's stressful. And again, living under the roof of CW5 Lloyd Dillard, who did it in some very hairy times. And so looking at him as a role model for that, and my mother, who was a teacher, they just fought and worked hard. And so they instilled that work ethic, but it just seemed to me, man, this isn't fair. I've got to work so much harder than everybody else just to get a particular rating. Now, I will say, God blessed me, and He put me in circles with people that showed me how to maneuver the politics of it all. Sometimes you have to understand. But again, as a young lieutenant, you're 20 years old. Yeah, politics was not a strong suit. So I had to learn quickly how to maneuver in that world. And God did bless me. I was able to retire as a lieutenant colonel. But again, understanding who you are and what God put you on this earth to do. What is your purpose? And as long as you continue to press and move, and I would tell you, your faith, you have to. I don't see how people make it without God. You have to have something to be grounded in. And so faith and family were those 2 big things for me.
Last time you stopped, I got a note here from Rod McCants in Huntsville. He wants to know, how did you survive, or how are you surviving? Is probably more key.
How am I surviving what now?
I said, how did you survive, and how are you doing now?
I tell you, faith, family, and fitness. I can't do anything without God, apart from God. And of course, my parents raised me up that way. My grandparents was a preacher. My grandfather was a preacher. My mom's side, and my dad became a pastor. So it was ingrained in me. Didn't always walk on the right side, but it just gives hope to all those parents out there who are raising your kids. in the church, it's true what God says. Train them up in the way that they should go, and they shall not soon
Mm.
depart from it.
Yes.
And so, it may take us a minute to get back, but if we've got it in us, we're coming back. And so the faith portion was huge. And then I had to seek help. Now, again, I talked earlier about the stigma of trying to go get help, and the reporting mechanisms that the Army has, and letting supervisors know when soldiers are going to get help. The Army has made some strides in that. It's not so much a stigma anymore, but it is a mindset for the soldier uh, to get over the fact that I gotta get help. You know, they teach us that we can do anything. I mean, we're a killing machine, right? We fight and win the nation's wars. That's what we do. And so to admit that you need help, that you're weak in an area, doesn't mean that you can't continue on with your life. But now I've been blessed enough not to have to take medication, but I do have to go to therapy. I have to talk about it. I have to get it out and get it off of my chest. I need solutions to some of the issues that we face in the world today.
Just
So that's
let me give honor to your father, who I happen to know who he is. For the audience, her dad is a W-5, and in the military, that's a huge honor. CW-4 is normally our highest rank, but your dad made it CW-5, and you and your family put him away nicely in Arlington. So congratulations to you and your family. Can I come back to you in a minute?
Yes, it was an honor to be able to do that. Absolutely.
You did a good job. Let me go now to our neighbor, Jean, who does not want to work in Alexandria, and talk about some of our conversations around what you think you can do in our city, John.
Yeah. Well, Colonel, I think what you meant to say is that we're desperately looking for ways to work in Alexandria. It's just that is in our own backyard. When we look at the ongoing effects of the pandemic, the ongoing effects of racial unrest, and the reckoning that's taking place, the pushback on DEI, the polarization that's taking place more broadly, on top of what we're going through as individuals and families and communities, as Dr. Dillard so excellently said, we need family, faith, and fitness as part of our strategies. And as Christian mentioned earlier, no one organization can do this in isolation, that we really need to come together and talk about what are the strengths that each organization brings to the table, and how do we ensure that we're putting the community at the center. So at CHC, what we're doing is doing just that. We like to be invited in, Colonel. So if the city of Alexandria would invite us in,
We've had this conversation before. You keep telling me no.
to have these conversations, because it's important, because it's the community that knows what's best and what they need, not one particular organization. And what we would love to do, which is what we've done in other communities across the country, is spend the time listening to what the community says they want and need, understanding all the different organizations that are working in the community, come up with a strategic way for us to come together to come up with a holistic action plan that the community is driving. Innovations are taking place. What we do is we actually provide what we refer to as capacity enhancing support, meaning the fact that the community-based organization that we work so closely with, they're the experts working with community. They're on the front lines. And our goal is to help enhance that, to amplify that, to really think about how do we ensure that the system, if there is such a system, is really focused on the person and the family and their needs. So a lot of the work that we do, we call it a landscape assessment, meaning the fact that we take the time to listen. We try to understand exactly what are the intended and unintended consequences in a community. If your life expectancy is driven by where you live, that it is significant. And in DC, in Alexandria, and also in Anacostia or Georgetown, you see significant differences just solely based off where you live. And that shouldn't be the case. So as an organization, Colonel, we want to work very closely with the city. We want to hear what the needs are. We know what the data is telling us. And then we want to work in partnership with other organizations as a convener and a connector to really ensure that no one is falling through the cracks. And I can give you countless examples of what we've been able to do.
Give me
To
one. You mentioned, was it Indianapolis that you mentioned before?
that is exactly right. So we're engaged in many communities across the country. Indianapolis is one, Cleveland is another, Atlanta, Detroit, LA, and but the model and the approach to doing this work, because you need community buy-in.
Hmm.
And when we think about sustainability, we have to ensure that the ecosystem, in terms of where you live, that the organizations who are on the front lines have the resources and have the capacity enhancing support in order to ensure that the needs are being met. So that is what we do. It's end to end. It's community focused, community centric, capacity enhancing support, ensuring that we're breaking down these barriers, because the barriers can look different in any community.
I'm going to come back to you in a minute. I want to go to Christian and talk about the 27th and the rest of the summer. What are the plans at the church uh, to address mental health uh, going into September?
Yeah, so going into September, so once we have our interfaith service and program that's going to take place on July 27th. We just launched a mental health ministry at St. Joseph's, and that's going to be there to have support and conversation. What we're hoping for, and what we've heard from a lot of people, is the need for community when talking about mental health. There are a lot of thankfully, a lot of people are going to therapy. I wish everybody went to therapy, but we'll save that for another conversation. But once people are in therapy, or let's say they're on a medication regimen, they don't have a support system to kind of work that out. So
Mm.
rather it's in their family. And so what we're going to provide at St. Joseph is a place where people can come, have coffee, and talk. It's going to be a mixture of people with lived experiences as well as caretakers. And that is just to give people support and encouragement. I'll use an example of why this is so important. We recently had an individual who had a moment of crisis. Fortunately, they were able to get help and go into hospitalization, become stable with some medication and therapy. And upon being released, there was no support system
Mm.
there. And I don't like the word accountability when we're talking about this. We're talking about support, making sure the person has the medication, or if they need somebody to take a walk with, or somebody to accompany them to an appointment, or just to have encouragement. Not everyone has a faith community or a family or a social network that can
Mhm.
help them maintain their wellness. And so, again, these are the lanes that faith communities can provide. We're not clinicians. We do have some people who are trained in mental health first aid, or who are certified peer recovery specialists, but we're not clinicians, but it's just to offer the support, the accompaniment. And so hopefully we're taking the lead in that as a faith community. We'll see that roll out in September here in Alexandria. And, while we can't take on doing it every single week, we will be faith communities throughout Alexandria that will step up to the plate, and we'll have a good rotation of places where people can go for support and accompaniment.
Can you talk about what you're doing with voice and mental health?
Certainly. Voice is such an important organization. Virginians organize for interfaith community engagement, and it's a community organizing social justice group, a network of interfaith communities and churches throughout Northern Virginia. So right now we are in Prince William County, Fairfax County, Arlington County, and the city of Alexandria. We have mosques and synagogues and Catholic churches and Presbyterian and Baptist and Unitarian. But what we're all doing is putting our faith into action. When we put together our numbers, we have power to create and make change. And so we go after that from a legislative standpoint. So, rather it's with your county board of supervisors, your city government, or at the state level, of making sure that there is funding for things that need funding, like affordable housing, like behavioral health services, crisis intervention centers, but also things that are holding people back on a systemic level. One great voice victory was in the state of Virginia. If you had court fines for anything, it could be traffic, anything. If you had a court fine that went unpaid for whatever reason, the state of Virginia would suspend your driver's license. Now, for our vulnerable communities who are trying to get back and forth to work, who are living on very fixed incomes, or who just have an issue with maybe having, if they have housing insecurity, not having the same address all the time. If you didn't pay that court fine within a certain amount of time, your driver's license was suspended. Now, of course, in the state of Virginia, if your driver's license is suspended and you're driving back and forth to work, you go to jail. Well, how are you going to pay your rent? How are you going to take care of your kids and your family? So this was targeting people who are at their most vulnerable. The voice leaders and congregations got together after doing listening sessions with the community and said, we have to change this. That was changed. So these, again, I talk about the responsibility of faith communities. By building power together, we were able to change legislation. That actually, I think the day that that came about was tens of thousands of people, mostly black and brown, mind you, and mostly living under the poverty level, license were automatically reinstated. This enabled people to travel safely, to get back and forth to work. So this is what faith communities can do when we get together and work together. Voice Alexandria, we have two teams right now, our affordable housing team, which is winning millions of dollars towards creating more affordable housing within the city of Alexandria. Our mental health team, who is doing a series of listening sessions from the community. We know that our youth in particular need to be heard. What do they need? It's a need for us telling them what they need. We need to hear from them. What do they need to make sure that we are setting them up appropriately to deal with their mental health?
Uh, Kristen, you mentioned affordable housing. I want to be real careful that we don't uh, present a look of it's okay that the housing situation is good in our city. It's not.
It's not.
Can you talk a little bit more about what we're doing about it?
Certainly. So Alexandria, like many communities across the nation, are suffering from gentrification. What has happened, and I love Alexandria. I'm a 10th generation Alexandrian. My family has lived in this city since the 1700s. So that's before the United States existed, when we were the colony of Virginia. And so I have a deep interest in what our community does. What has happened is we've become this great destination, and some people think that we're Beverly Hills or the Hamptons. I don't know when that happened, but that's kind of what we're shaping into.
Mm.
The cost of housing is astronomical. There's almost no place, and I'm not saying this as a hyperbole. I'm stating this as a fact. There is almost no place for lower middle class or low income individuals to live in the city of Alexandria. I mean, that is a statement. So I think the average house cost in the city of Alexandria right now is about $850,000. A one bedroom condo goes for about $650,000. And so for the people who maintain our community and keep it together, our first line workers, our responders, so that's everyone from our line cooks and chefs, all the way to our teachers, nurses, and police officers, cannot afford to live in this community where they work and serve, which to me is an affront to the dignity of them as a person. And so in Alexandria, we are fighting for, we have 3 projects in the pipeline that have already been approved by the city council. However, we have not approved the funding for it. And so that is what we at Voice are fighting for, the funding to get these projects moving, because we have people that are just sitting on the sidelines. And when you have the Supreme Court, I just want to state this real quick. We have the Supreme Court making decisions that can put our at-risk homeless and housing insecure population at the front of being criminally prosecuted. This is a time where the city of Alexandria, we have the financial capacity to take care of our citizens. It's really up to our faith communities to make sure that we have the moral capacity and compass to take care of our most vulnerable citizens.
Appreciate it. For the audience, there's questions coming across the screen. We can't answer them all. We'll tape it and then we'll get back to them separately. John, you came from AARP. Tell me about that transition and what you brought from them that you're trying to bring here.
I really appreciate that question, and just kind of building up from Christian's points and also from Leslie's. When you think about holistic health, we're talking about holistic health across the lifespan, meaning the fact that if our youth, if they're suffering, then you can just imagine it just compounds as you get older. And I always say that when you look at disparities and the differences in health outcomes at older ages, however you might define that, those disparities didn't happen once the person turned 50 or once the person turned 65 or 70. those were actually disparities that had existed well before they turned that particular age. So for my calling, what I believe my purpose is to really think about how we need to start to break these stereotypes and break the systems that have basically filtered who is deserving and who is not. And what does it actually look like in a particular community? Everything that we're talking about here is interrelated: housing,
Mhm.
transportation, education, healthcare, and it all shows up at the local level. It all shows up at the local level. And families are not only dealing with one issue, they're dealing with a multitude of issues.
Mhm.
So the work that I've been called to do has been to really think about how do we start to convene and connect and really think about the systems in a way that actually better serves those individuals who've been disproportionately impacted, marginalized, left out, and in a way that can really ensure that people can live a longer, healthier, more productive life. Uh, how that shows up is the work that we're doing. I'll give you a good example with maternal health. We have an initiative called the Black Birthing Initiative, which is designed to address the huge maternal health crisis in our country. Black women, in particular, are disproportionately impacted by a range of stressors and see extreme preterm labor at an alarming rate that can all not just impact their health, but clearly impact their family. In fact, it's three times, and it doesn't matter what your education level is. African American women are disproportionately impacted.
Well, why? Tell me why.
There is a confluence of factors. There's the stressors. It's called the weathering effect.
The
Is
weather effect?
the weathering effect, which deals with the stressors of being a person of color in this country. It deals with the structural inequities and racism that exists. It deals with what we're talking about here in terms of your local community and what messaging is being signaled to those to individuals in a community. I had an opportunity to talk before he became governor, Wes Moore. And Wes Moore said that when he was growing up in Baltimore, everything in his neighborhood screamed that he did not matter,
Mhm.
that his family did not matter. And if you have not heard about his story, but his father was feeling ill, and they took him to the emergency room. And Wes mentioned that the doctor looked at his father and them and basically said that you guys don't have resources, or basically stigmatized his family and said, "Look, there's nothing going on here. You go home and go rest, and you'll feel better the next day." They took his father back home, and as his father was going up the steps, he collapsed and died. Never got a chance to see his son become the first African American governor for the state of Maryland.
So, John, what do you do with that as a professional? How do you turn that into an action item?
So what we've done is take that action item, this the weathering, the stressors of where you live, as part of our Black Maternal Health Initiative, and ensure that there's wraparound services to ensure that individuals are receiving the support that they need. When we started this program, which has only been around for just 2 years, we currently have 400 Black birthing individuals who've gone through the program. And when you look at the baseline data, significant percentage of the Black birthing individuals had high levels of depression, high levels of anxiety, high levels of stress. 2 years into the program, we've seen significant, a 72% decline in anxiety rates, depression rates, because they're getting wraparound services, they're getting the support that they need throughout their maternal health journey. We've seen a significant increase in terms of housing stability, food security as well. And when we look at outcomes, because this is all about outcomes and health outcomes, what we found is the fact that for the participants who've given birth, 72% of the Black women who've given birth to date have given full term births. The national average for African American women in the United States in terms of full term births is 52%.
Mhm.
So when you think about the wraparound services that Christian is talking about, and you think about bringing people together and ensuring that people have access to housing, access to food, ensuring that they have the support that they need in order to really uh, be at their optimal best, you actually see better health outcomes. And just looking at the data that we have so far, those 72% of the women who've given full term births, that represents a cost savings to our healthcare system of $2.2 million, right? So there is an opportunity when you're doing this work to think about how we're bringing people together and organizations together to address the mental, the physical, the emotional, the spiritual, the financial needs facing an individual. And when you can provide those wraparound services and making sure that the individual and their families are at the center, driving that care, and they feel supported and have the tools to advocate, you see better health outcomes that also saves government and our system's dollars.
Hmm.
It's a win-win proposition.
I guess for all three guests, John, what you just described is a medical issue, but isn't it more of a social issue too, like social? Uh,
Or absolutely.
how,
I,
how, do you, how do you see those things being wrapped into one program? Social justice and mental health.
yeah. There is a crisis in our country, both in terms of the lack of funding to support our mental health services, as well as within, in terms of who's actually receiving services at what rate. So when we talk about social justice, we need to think about the fact that we have an opportunity to galvanize as a community and as a society around ensuring that every single person has the support that they need in order to thrive. But in order to do that, there's a difference between equity and equality.
Oh yeah,
Everyone talks about
yeah.
equality.
The fence is still there though.
Yeah, you can't get to equality without addressing equity.
Yeah.
Meaning that when we look at who's getting services, who's getting the support, there's huge disparities that exist. So if we're really going to tackle this from a social justice perspective, we need to make sure that we're actually closing those gaps, particularly in the communities that need those resources and frankly deserve those resources.
Christian,
Colonel Page,
please.
can I add 60 seconds to that real quick? This is one of my biggest pet peeves, and Christian by himself does not have the power to change this. This is going to take a coalition. But, one of the things you talk about equity and access to services that really gets my goat is many clinicians do not take insurance. A lot of therapists do not take insurance, and it's because of the barriers that we as a society allow insurance companies to create in paying therapists.
Mm.
And so, because and I won't go into the deep details of it, but a lot of therapists do not take health insurance. Well, how many people have the ability to pay for healthcare services, i.e., therapy, out of pocket?
Right.
And then when you do have someone that does take insurance, the wait list can be 6 months long. If you are in crisis today, you don't have a crisis receiving center in your area, you work a job, let's say, you're budgeting, we're all suffering from inflation right now, you're getting by. How do you pay for therapy out of pocket? That can be, upwards of a couple of $100 per session. And so that person who is in crisis doesn't receive the help that they need. And let's say the horrible end of that is that person suffers by succumbing to suicide. This is what we're talking about, where it is a life or death issue when you do not have equity in communities. And this is why not only am I a mental health advocate, but also a social justice advocate, because it's because of these inequities. Like, and not to be over emotional about it, but to drive the point home, this is costing people their lives.
That's
And a
exactly.
lot of people are dying from the side effects of mental health issues that are going unreported. We have numbers that are already astronomical and heartbreaking, but that doesn't take into effect people who are housing insecure, people who are using drugs and alcohol to self-medicate. Nobody wakes up one day and says, I want to be addicted to fentanyl.
That's exactly right.
That is a direct result of someone having poor mental health, not having the social and economic and social structure around them to give them the support and help that they need. So this is a huge conversation, and when we're talking about this from the context of being in a Black and brown community, as men, as women of color, as people in leadership, this is imperative that we continue to talk about this and recognize it has to be more than a conversation. It
Exactly.
has to be more than getting some grant money. We have to create systemic changes that stop ostracized brown communities where it is literally killing us. I mean,
Christian,
I can get into obesity, that it
yeah.
all goes to the
Yeah.
person's mental health.
Christian, who is we?
Who is we? I think it's we as a society. It is not just the four African Americans that you see on screen here. It's every single person. It's our grocery store. It's our coffee shop owner. It's the local food chain owner. It's our teachers, our educators, our fire departments, our mayor, our city council, our elected officials. All of us have a social and moral obligation to each other. Even if you're not a person of faith, it is just innate to who we are that we must take care of our neighbor. We must have empathy for them. We have so much empathy as a society for dogs and cats that we do not show other human beings. And it's a true travesty that we've allowed our society to get to this point.
Listen, let me stop you. Leslie's got her hand up. Talk to me, Leslie.
I think it ultimately gets down to what do we care about?
Yeah.
We don't focus on mental health until a Walmart gets shut up.
Mm.
And it comes out that the person has been suffering from some mental illness for years. We have to be our brother's keeper. We really have to be our brother's keeper. Knowing what's going on with your neighbors. And it's not a matter of being that one person in the neighborhood that knows all the business. It's just knowing enough about your neighbor that when they need help and aren't strong enough to reach out, then you reach for them. It's understanding different situations. If you see something, and of course in Homeland Security, we say if you see something, say something. So if you see that your neighbor is struggling, or a friend, or even a coworker, it's how much attention are we paying? I have a friend that tells me all the time, we innately as human beings are very selfish. And so we're always looking at what's good for us. But what we have to realize is in this situation, what's good for us is looking outward and taking care of our community and our neighbors.
Absolutely.
Leslie, go ahead. John, you had something? I'm sorry.
No, just building up on that, and the taking care of our neighbors cuts across industries and sectors. And when you say who's we, I think employers have a significant role to play. I think wherever you work have an important role to play in terms of creating that environment, because I think it's three layers to this. There is the societal, that includes companies, government, organizations. There's the how do I perceive mental health as an individual, right? And then there's the broader elements to this in terms of what are the systems that are in place that need to be revamped, and that cuts across. And so the we is collectively is the fact that this is something where as individuals we have to be able to talk about it and normalize it, break the stereotype, and counter those narratives and those stories. I think is critically important. Create an environment where you can actually have these conversations.
We had lunch last week and we talked about our school system. What is the one bit of advice you would offer to our school system?
Is to educate. I think education awareness is critically important, and I think it starts and that doesn't stop at the school system. But to what extent are we educating and bringing awareness around mental health is critically important. What are the tools that we can implement, whether that's low cost or high cost? What are the techniques that you can start to teach students of all ages and all backgrounds around managing your mental health and why it's okay? I saw a comment that by Raul who said that you can't talk about health without talking about mental health, and that's absolutely correct. But when I think about going through school, there was not a topic on mental health. I learned about all aspects of health, but not mental health. And even when I was in college, I don't think that actually came up in the course of some of the courses that I took. So I think that we have an opportunity as it relates to our education system at all levels to highlight, educate, bring awareness to, and provide tools around mental health.
Yeah, guys, we've got about 4.5 minutes left. I want to make sure that I give you a chance to say goodbye. It's elevator pitch time. You got about 30 seconds on the elevator, Christian. What do you want to share with the community in the ways of advice, not complaints, just advice very quickly?
I would say be open to conversation, even if that conversation makes you uncomfortable. If someone is talking to you, they're not necessarily looking to you for answers. And the greatest thing in the world is that all of us possess one of these things. And if you don't have an answer to something, you can Google it.
Mm,
Open to having a conversation that helps break down the stigma and gives people an outreach. When we have a record number of young people succumbing to suicide, I
right.
think we need to make ourselves more available in conversation.
Dr. Dillard, elevator's still moving. What do you have?
Don't suffer in silence. There are resources available. Open your mouth and speak. Nobody is going to care more about your well being than you are.
That's right.
Amen. Amen.
Ryan, your shot. Tell me. Talk to me.
For me, I think is think about a support system. If you don't have one, think about strategies and approaches to actually creating a support system as part of your journey. Mental health is critically important, is a key element of our holistic health. So, looking for opportunities to have a support system, also looking at ways in which you can inject joy in your life, whatever that might look like for you, is critically important.
Talk to us about what you're doing with APAF and mental health journey this year.
Well, it's been an amazing pleasure, in fact, by invitation by Raw to partner with him and his team to look at ways where we can actually elevate, amplify, and support the mental health needs, particularly of African American men. And really thinking about ways where at the community level and also through different partnerships where we can start to close those gaps by not just spotlighting what the issues are, but also what the solutions are. And I think that the more we can actually break these stereotypes and break the stigma and actually elevate this as a public health crisis in our country, and that the more individuals are willing to talk about their own mental health journeys, it gives others permission to do the same. And then we become to normalize it. So we're on a mission working with our corporate council, on a mission working with our 5,000 nonprofit partners, on a mission working with our many of the communities in which we have been invited in. And I hope that Alexandria will be one of those communities to invite us in to really think about how we accelerate the pace of change through partnership to address these inequities.
Wow. In January, when you got your award for the Presidential Lifetime Achievement Award, we talked about taking that award and doing something with it with your colleagues. You've got doctors and lawyers now in that network. Did you see that being a good platform to address mental health?
Absolutely. Mental health at all levels is critically important. And I think that even oftentimes we as a society tend to spotlight the successes, not realizing that even individuals that are deemed quote unquote successful by societal standards are have their own struggles. And I think that the more that we can actually talk about that, the better we will be as a society and as a community. And I think that deeply honored by the award and the network of amazing leaders. But I think that also has been an amazing opportunity through your leadership, Colonel, to elevate mental health as a key pillar for our community and bring all of these different leaders together to talk about ways in which we can join forces to break the stigma, have these conversations, and create resources to meet people where they are.
John, thank you for joining us. Christian, you got 30 seconds. You're talking to the Black Catholic organization. What is your message to them?
I think my message to all faith communities is to recognize that they have a responsibility, a spiritual and moral responsibility, as Leslie mentioned earlier, to be our brother's keeper. And that looks different for every single institution. So not everybody's going to be a food pantry. Not everybody's going to have a rental assistance program, but there is something that we can all do. So as a faith community, regardless if you're Christian or Jewish or a Muslim or non-denominational, whatever, but just pray and think about what can I do? It may just be opening the doors and having coffee and donuts one Saturday a month or one Thursday evening a month, giving a support system to people who are struggling with mental illness or are caretakers of
I'm going to
those
give
who
you
are
the last
struggling
word,
with mental
Christian. I
illness.
got a note here from one of my colleagues about breakfast at St. Joseph. What's the menu this time around?
Well, I think we're always going to have Beverly's famous grits. So Ms. Beverly Anderson, she's the glue that keeps our church together, and she always hooks us up with some good Southern grits. I always go for thirds. Don't judge me.
We're out of time. Leslie, thank you. John, thank you. Christian, always a pleasure being with you. To the audience, this has been a fruitful day for all of us. So wish you well, and I salute your dad, Leslie. Take care. Be good.
Thank you.
Thank you.